Hi, my name is Niemann-pick. My registration number is 1849119. Hi, my name is Laika. My registration number is 18493.
Yes, my name is Muhammad Syazir Amzar bin Muhammad Kanduri and my matric number is 181939.
I'm Rowelie. My matric number is 183414.
Lastly, my name is Nurshazana binti Muhammad Ghani. My matric number is 181942. One of our members absent because he got and
Nothing matters.
Her name is Chong Shen. So let's proceed with our discussion today.
And before that, I hope I will have to watch for the video.
So last week we were giving assignment by the principal to discuss on the Niemann-pick disease in kittens. Yeah. Okay. So I will just give you all a little bit information about the Niemann-pick disease. Okay. Niemann-pick disease is a lysosomal storage disease, which also known as syncytial. Okay. It is an autosomal recessive hereditary disease due to the lack of the enzyme called syncytial. So actually, Niemann-pick disease is also called syncytial and is caused by the heart disease because the lack of the enzyme called syncytial. Okay. This is caused by the accumulation of syncytial within cell of the nervous system and organs such as liver, lymph, kidneys, lung, and intestine.
Oh, they are not accumulated in muscle, only the nervous cells.
Yeah.
Like a slim
Nervous system.
nervous system.
Not in the muscle.
Yeah, no, because syncytial is in the brain. Yeah. It's within the cell of the brain, nervous system, and some organs such as liver, lymph, kidneys, lung, and intestine. Okay. Such about the clinical signs. Clinical signs are appearance from 3 months of age and include ataxia. Ataxia is uncoordinated walking.
Is it like a jumping?
Yeah, I think so.
Because it can say that after the ataxia is also hyperlipsia. Hyperlipsia means height that doesn't walk. Maybe it's just like what they are saying, just like the jumping. And then,
Or like baby. Baby.
Oh, they wobble.
Baby.
Okay, then just like it also loss of balance and play. Okay, then there are also some cats in cats. Some cats show liver swing, and the liver and spleen may be relatively enlarged. So greatly paralysis develops with most cats dying before 1 year of age. So the infected cats will be dying before they reach 1 year of age.
For the maximum lifespan for the affected cat is 1 year. Average.
Then diagnosis relies on demonstrating the enzyme deficiency in tissue, such as liver, brain, or skin fibrosis. Just now I said that this result in the accumulation in the organ tract and the nervous system. And in the diagnosis, the enzyme is deficiency in tissue. Right? Yeah. So then I will continue what is more detail on Niemann-pick disease. From what I have searched about this disease, it is commonly happen in humans and also cats. And for the cat, it happens mostly in Siamese cat, and I think one type of, and the other type is of other kids. But the other one I don't remember its name, but it commonly happen in Siamese. And this Niemann-pick disease is a condition where it affects many body systems, and it has a wide range of symptoms, just like you said just now. And Niemann-pick disease is divided into many types. For example, like type A, type B, T1, T2, D, and also E. It has phenotypes, and these types are classified on the basis of genetic cause and signs as well as symptoms of the condition. I actually found only in humans, and I'm not sure about the cat, but in humans, Niemann-pick disease type A usually develop an enlarged liver and spleen, and it fails to gain weight and grow at the expected rate, experience progressive loss of mental ability and also the movement. For the children who have this disease, also develop widespread lung damage, which can cause the respiratory failure, and it and for the disease type B, it usually present in mid-childhood, and the sign and symptom is more similar to type A, but not as severe as the type A. And people with this disease often have hepatosplenomegaly, which is recurrent lung infection, and also has, in order to differentiate disease type B and A, type B usually has a low number of platelets in blood. People with this disease have a short breath, and they usually have a cherry red spot eye abnormality or neurological impairment. And people with this disease also usually can survive into adults.
No, for human they can survive with that.
Yeah.
But
For type B. For type B.
type B.
What type B?
Type C or
Type C. Type A. Type A. I'm not sure, but for type B they can survive into adulthood, and I don't think for type A. I'm not sure for type A they will survive, because type A is the most common disease that happens in humans, and also for type C. Until 1 year of age. Then I continue to type C. Type C also similar to type A and B, but it differ only in their genetic cause. Type C usually appear in childhood, and their symptoms can develop at any time. And people with this type usually develop difficulty in coordinating their movements and inability to move the eyes vertically.
oh no, I understand. The type B, like that.
Yeah, type B.
Type B is disease that start with the spleen. So when the spleen cannot function properly, so the person will start to lose weight. And have another problem like respiratory problem. But for the C, it is I think it's the dangerous one because it affects the it has something to do with our movement. It affects the nervous system.
the nervous system, then it affects your
So that's why people can't move their eyes. It's related to movement, but for the C, it's related to for the
So that's all for my research. Okay, since Niemann-pick disease is a rare disease variant, so I will tell you a little bit about how common is this disease. So Niemann-pick disease type A and B is estimated to affect 1 in 250,000 individuals. So
1 is 50,000.
250,000.
There's no 800.
Niemann-pick disease type A occurs more frequently among individuals of Eastern and Central European than in the general population. Then it began within the Scandinavian population is approximately 1 in 14,000 individuals. So type A is more common than type B. Then combined, Niemann-pick disease type C1 and C2 are estimated to affect 1 in 150,000 individuals. So and type 5 and maybe. However, type C1 is by far the more common type. It accounting for 95% of the tumor cases. So the disease occurs more frequently in people of French in Nova Scotia. In there, a population of affected were previously designated as having Niemann-pick disease type D. However, it was found that these individuals have mutations in the gene associated with Niemann-pick disease type 1. You get what I mean?
Yeah, but I just wonder why the disease mostly happen in France or
Maybe because of
since
Environment.
environment.
But you cannot confirm on that.
Since I think since the disease is inherited, so if let's say one person in the different country have the disease, so it is inherited to the certain, so the certain is inherited to the certain. It might continue from generation to generation, right?
But they also might stop if the gene is not given to the
So that I think that is why it's concentrated in the hereditary.
But you can also, because of disease, it can also, because of our diet. Proper diet. So I think
genetic disease.
Why diet?
this is what I feel. Because when you, for example, when you take fat, cholesterol, carbohydrates, then when it do not digest properly, and it will cause the inefficient in remove the action of the nutrient, right? So when it happens like that, so it causes the organ to properly function. Properly function.
But I think the cause or the root for the improper
Improper or improper?
my point is like if the person overeat the because of overeating.
I don't know. Because that's what I'm saying.
Oh, you think? But I think the failure to process or to convert the disease or to remove the disease, maybe they lack of enzyme and it also because it also the root for the problem is the gene. Maybe they can believe.
So you can have further research. How about the intestine?
Oh, that only for humans.
Yeah.
For cats, since it is mostly related to the central nervous system and cerebral nervous system, so it mainly it affects the brain, and when the brain affected, the neurologic signs at onset are variable, developing between 2 and 5 months of age. I think but mostly they will affect our brain nervous system. So when the brain are affected, they will get tetraplegia, hypotonia, and anorexia.
These are all for cats.
This is for cats. And clinical time infested at 6 to 8 weeks of age, characterized by subtle intention, tremors. What? The tremors. But this, the tremors. Okay. The tremor is referable to cerebral disease. Like what before this Steven just said to me, what the tremors is like uncontrollable movement.
Oh,
That one.
you don't have control over your
The unstable, the
shaking.
not shaking. Dia shaking.
So you have constant shaking because you cannot control.
Because of because the nervous system is affected. I think that's all.
Okay, I'll move on to the diagnosis of this disease. The Niemann-pick disease is diagnosed based on clinical signs and histopathology and biochemical evidence of reduced sphingomyelinase enzyme activity, including tissue accumulation of sphingomyelin, cholesterol, and also glycosphingolipid. So the accumulation of sphingomyelin will cause this disease. Immunocytochemistry shows that both gangliosides and unspecified cholesterol are differentially stored in neurons of the cerebral cortex, cerebellum, and hippocampus, as well as in the liver. In one of the reported cases, a 7-month-old how do you
Wonder.
No, it's a kind of Balinese cat. The cat has progressive neurological dysfunction and had histopathological lesions of brain, liver, kidney, skin, and also lung infection with a lysosomal storage disease. The ultrastructural examination revealed that the lysosomal hypertrophy is found within the cat. Hepatic sphingomyelin and cholesterol were elevated 10 times more than the normal, and the total phospholipid has increased 3.6-fold. The sphingomyelinase activity measured with labeled sphingomyelin at pH 5 was virtually absent in the brain and liver. Although other lysosomal hydrolase activities are normal. So clinically and morphologically, the biochemical findings suggest that this cat has sphingomyelin lipidosis, very much similar to human Niemann-pick disease type 6, and that the feline sphingomyelin lipidosis provides another model of human lysosomal storage. And in the central nervous system, the vacuolation and granular distension are seen in neurons and also can be motor. The macrophages with accumulations of granular material are referred to as the Niemann-pick cells, and these are dispersed throughout the central nervous system and also body organs. So,
Is there any treatment for
So, I'll talk about treatment. The treatment of individual failures is unrewarding and invariably leads to euthanasia or attention to diet in an attempt to lower blood cholesterol are being formulated unsuccessful. Since the experiments that done on this disease, on the treatment of this disease is quite not many, especially on kittens. So what I found is the treatment on mice. So I'll talk about the treatment of mice. The treatment of mice is N-deoxynidiramycin, NBDNJ, an inhibitor of glucosylceramide synthase, a pivotal enzyme in the early CSL synthetic pathway, has shown some delay in development of clinical signs, but no further studies have been conducted on feline patients. 2-hydroxypropyl-beta-hydroxysteroid, HT-beta-CT has shown promise as an experimental therapy for Niemann-pick type 3 disease in mice. Screening of adult breeders of affected research can help with identify career schemes and tasks. So, as a conclusion, there are no specific treatments to actually help the kittens that actually suffer in this disease. I want to add something because Niemann-pick disease type D is something is a disease that led of the blood. So I think maybe the transplant Yeah. But when I researched for the treatment for type A, the treatment is cannot be found for type A. Only for type B. Yeah.
What if we provide the enzyme that is lack in that individual?
They can buy plastic
Continuous treatment.
I
Take care of this enzyme.
Condition. So I think for the just hope that this disease will not increase. So that's all of important.
So since
Yes.
it is inherited, so maybe it is not spread by air or what.
I don't think so. It's an external factor.
Inherited, right?
So,
Our last
okay, thank you everyone.
Thank you.